My name is Dr. Gemma Newman. I'm a GP. I'm a senior partner at a busy NHS GP surgery. And my passion is holistic health. My passion is helping patients to get well in many ways, not just through nutrition, but of course through many other lifestyle factors. And that's why it was so important to me today to come and talk to you all about mental health. So, why mental health? Well, mental health charity Mind tells us that 1 in 4 of us will suffer from a mental health problem every single year. Which means that every single person who's listening to me here today has either suffered a mental health problem or loves someone who has suffered from a mental health problem. This is serious and it's important, and that's why I'm really passionate about it. The other reason that I'm passionate about it is because of my dad. I don't know if you can see him in this photograph, but he was a lovely man and a very kind man, but he did suffer terribly with mental health conditions during his lifetime. He had a number of medications, he went through electroconvulsive therapies, hospital admissions, and ultimately he died as a result of heart disease that he was more susceptible to because of his mental health conditions in part. So for me, it was a hugely personal tragedy that happened in my family, but I know that I'm not alone. I'm really not, because I see this every day in my clinical practice. So this is a picture of me here at work, and I see a lot of people who are depressed, a lot of people who are anxious, a lot of people who are struggling with day-to-day life because of their mental health. And I go so far as to say that mental health can play a part in around 80% of the people that I see every day in clinic in one way or another. So it's a huge, huge problem. And what does the Mental Health Foundation tell us? The Mental Health Foundation tells us that this is a problem for children. About 1 in 10 children will suffer from a mental health problem, to include things like self-harm, depression, anxiety, conduct disorders. And what about grown-ups? Well, England's national statistics are quite interesting. So the Adult Psychiatric Morbidity Service puts these together every year. And they tell us that about 1 in 6 of us will suffer from a mental health problem as adults. Slightly more women than men, 1 in 5 women, 1 in 8 men. And that would include things like depression, anxiety, obsessive compulsive disorder, post-traumatic stress, that sort of thing. So this is a huge problem, not just for the people who are suffering, but for their families, for the society at large, for the workplace, and also for our lifespan. I mentioned my dad and his heart disease, but it's true that when you have a good diet, that's not the only thing that helps your mortality rate. It's also about how you feel. Now, this is a really interesting systematic review. And in this review, they looked at 70 different studies. And they were able to ascertain that if you had a good sense of humour, a positive outlook on life, general good well-being, even if you were in a diseased population, even if you had a chronic disease already, you actually, statistically speaking, had a greater chance of surviving than people who were generally well, but also quite low in mood or pessimistic. And this is also interesting when we look at our chances of getting sick in the first place. Now, I think this is a really interesting study. It was done by Carnegie Mellon University. And what they did was that they wanted to see, look, could your mood affect your immune system and whether you got sick or not? So they got volunteers, and the volunteers had to let them squirt nasal flu viruses up their nostrils. They did pay them about £500 equivalent. Hands up who'd let someone do that to them for 500 quid? Well, 1,000, someone said 1,000. When I was a student, I would have let someone do that, but not now. Anyway, what did they find? Well, those who were rated or scored as pessimistic or angry or hostile or low in mood, about 1 in 3 of them got sick. So that's quite impressive if you think about it. We do have a good immune system. It usually works, especially if you've been exposed to viruses before. About 1 in 3 got sick. But what happened to those who were scored as generally more positive? Well, unbelievably, it was only 1 in 5 that got sick. So that's a huge difference in the amount of people who got the virus. So what can we do to boost our immune systems and reduce our chances of not only getting sick, but also having a better mood? Well, as the topic of the talk implies, our food does have something to do with it. But every day we are bombarded by these messages about sweet, sugary, salty, fatty foods and how we really want them and how they'll make us feel good. And of course, the food industry spends millions and millions seducing our taste buds, getting just the right amount of dynamic contrast and using emulsifiers to help get that right sort of melt in the mouth consistency. Additives and chemicals to make us feel that we're hungry when we're really not actually hungry at all. So I also want to say it's quite hard to resist these things because we do get that dopamine kick. Who here reaches for a glass of wine or their favourite cheese if they're not yet vegan, or maybe a packet of crisps or chocolate or anything like that to make them feel better after a hard day? I do it, or at least I used to, maybe less so now. Yes, a lot of us do that. Who reaches for a plate of steamed broccoli when they're feeling low? Does anybody do that? One or two? A few, not many. So we have to try to understand, like, what is it that makes us do this, and how can we do this differently? And that's what this talk's really going to try and address with you. So what we're going to do today is we're going to gain an understanding of what we can eat to make us feel healthy and increase our chances of feeling happy. We're going to go over some of the science to boost your confidence to incorporate these changes. And also at the end, I'm going to go over my top tips to get started on this health journey. So let's talk a bit about the science, and where do we begin with the science? Well, I'd like to start with the gut-brain microbiota axis. So this is the relationship between our brain and our gut and the bugs that live in our gut, which kind of helps to decide what we do with our food and how it affects us. Now, the food that we eat is really information, and researchers have recently discovered microRNA particles in our bloodstream from very specific food types. Even things like cows and milk and rice mRNA has been found in our bloodstream. So if you look at it like that, we really are literally what we eat. And we use these little bits of information, these building blocks, to then build our bodies. So of course it's really important to feed ourselves correctly. And the three main ways in which the gut talks to the brain to tell us about how to feel is through the vagus nerve, through our lymphatic system, and through our gut bugs, or the microbiome. Okay? So we'll start with the vagus nerve. It's the wandering nerve, and it goes from the medulla oblongata right down to the gut and back up again. The information goes two ways. But interestingly, there's a lot more information that goes from the gut up to the brain than from the brain down to the gut. So you have to wonder who's really in charge of the signals going to and from our brain. And the second thing is the lymphatic system. Now there's only one cell on the gut lining between us and the outside world. So it's really important that we can protect ourselves from potential toxins and foreign bodies essentially that we're ingesting, which is why about 80% of our immune cells reside down here, right next to our gastrointestinal tract, and they communicate with our food. And so that's a really important way in which the gut also communicates with the brain. And the last way is through the gut bugs. The last main way is through the gut bugs. Now, a lot of you have heard perhaps about the microbiome and its importance for so many reasons. And it is incredible because there are more microbes in our gut than there are stars in the galaxy. It's really incredible. And they are responsible for manufacturing certain neurotransmitters, such as serotonin, although I do have to say here that actually the serotonin made in the gut doesn't go directly into the brain, but tryptophan does, which we can come on to later. But it also has a role in modulating our dopamine response as well. So there's a number of ways in which our microbes can affect our mood. And it's not just about the neurotransmitters, it's also about what they're fed with and how that can affect our mental health. You see, what happens is these gut bugs need food, and they tend to thrive on certain types of food. And they are the most plastic of all the different factors between the gut and the brain. So they're the thing that changes the most. They're the most vulnerable. A course of antibiotics, pesticides exposures, these are the kinds of things that can wipe out our gut bugs and affect our mental health far more than you could imagine. So we have to treat them right, we have to protect them, preserve them, and feed them right. So what do we feed them with? Well, we feed them with prebiotics. Hands up who knows what a prebiotic is? A few of you. Right. Prebiotics, essentially what they are is dietary fibre. Can anybody tell me how much dietary fibre there is in a small steak? Anybody tell me? Wow. It's almost as if I'm talking to a room full of vegans. Yes, 0 fibre. So where are you going to get your fibre from? Vegetables, yes, yeah. Vegetables, fruits, vegetables, whole grains, beans, lentils, chickpeas, oats, herbs, spices. All these incredible, healthy and dynamic foods will feed your gut bugs. And what happens is your gut bugs break them down into short-chain fatty acids. And these are small molecules that go into the bloodstream and tell your brain that everything is okay. They're really important. Acetate, butyrate, propionate, these are the main ones we know about. And they are super important for us in terms of mental health as well as other bodily processes. So these are the things that we can do to help our gut bugs. It sometimes also helps to eat pre-fermented foods because you kind of getting a little bit of those gut bugs in your food already that way. So things like sauerkraut and kimchi, kefir as well, and kombucha. You're already taking in bugs that are beneficial to the gut through those foods, although sometimes they kind of can pass straight through, a bit like the cavalry. So that's why the dietary fibre is crucial, because that's the most likely way that the beneficial gut bugs will stay where they need to be. What can damage these gut bugs? Does anybody know what can damage them? Antibiotics, yes. That's one of the main things that can damage, of course. That's what they're designed to do. And antibiotics have been very useful because without them, our average lifespan would probably be about 15 years less. So they have had their uses over time, but of course we're overusing antibiotics to a considerable degree. And you can see from the picture that there's lots of other things that can kill off our gut bugs, but the main dietary source of antibiotics is in fact intensively farmed meats. So if you're eating meats from intensive farming practices, chances are that the animals have been quite cramped and close together, which means that by necessity they would have had to have been given some antibiotics to prevent or treat infections that they would have received because they're so squished in. And so when you're eating those foods, you're also taking in traces of antibiotic. It's the number one exposure, apart from actually taking a course of antibiotics, which would naturally kill off some beneficial gut bugs too. Pesticides are also important. Intensive agriculture, farming. You're going to be basically coating your gut with things that kill off the bugs that live inside. So that's another reason why I think organic, no-till, regenerative agriculture is such an important thing for the future. Alcohol. What happens when you drink alcohol? Much as we all love a drink or two, unfortunately, you're stripping your microbes with alcohol. It's what you use to sterilise surgical equipment. So if you're drinking it all the time, it's going to have an effect on your gut bugs as well. So other foods that you might want to be mindful of, we've got farmed fish, we've got processed meats specifically, obviously alcohol. I've talked a bit about the role of pesticides. Now, not to get too depressing, I know this is a talk about mental health, but trying to keep it light. Other things that we have no control over. So things that you may not have thought about, for example, things like having had a caesarean birth or having been formula fed as a baby. These are things that you, of course, would have no control over, and sometimes these things have been necessary. But it's interesting to know about them so that you can potentially reverse your own risk factors. Things like not getting enough sleep. Believe it or not, that can also damage your gut bugs. Living in an urban environment. Even over-exercising. And of course, we've talked about antibiotics. This is one of the major things. One course of antibiotics has the power to potentially disrupt your beneficial gut microbes for up to 2 years, which is really shocking. And we're beginning to understand more about the links between gut health and long-term disease. There was one study I read recently where if you had 14 or 15 courses of antibiotics in a lifetime, it could potentially increase your risk of certain cancers. Hormone-dependent cancers like prostate and breast, stomach cancer. So there's lots of new information emerging also about the role of autoimmune disease and gut bugs. So there's many different things to think about, which is why it's not just a case of sort of taking antibiotics just in case. There are other potential downstream consequences that us as doctors need to think about, but also it's really good to inform you guys about as well. Right, so what does the science say? Let's move on to mood and what we know from the literature that can help us to understand more about diet and mental health. Well, this is a really interesting study, and it was actually brought out this year, and it was around the role of food and anxiety. Now, they looked at nearly 46,000 people in these studies, and they were able to show that a diet that was lower in fatty foods was statistically significantly important for reducing the risk of anxiety, and more fruits and vegetables and phytonutrients and vitamins reduce the risk of anxiety. So this was a really interesting study that came out just this year. But what about studies that actually used food to treat mental illness? Have there been any of those? Well, there have been two that I know of. The first I want to talk to you about is the SMILES trial. Now, that was done in 2017. And what they did in the SMILES trial was that they used food therapeutically. So they had two groups. They had one group that were given social support and sort of mental health support as an intervention. And they had the other group who were given a modified Mediterranean diet. And they wanted to see the difference between the two. Now, the modified Mediterranean diet was predominantly vegetables and whole grains and fruits. They had a little bit of dairy, a little bit of meat, a little bit of olive oil and fish. But the vast majority of what these guys ate was vegetables, fruit and whole grains. And as you can see from the slide, the results were really dramatic. In the group of people who had the social support and the mental health support, only 8% went into remission after 3 months of the study. Whereas those who had the dietary interventions and nothing else, a third of them went into remission from their depression. That's 4 times the difference between people who were given foods versus other interventions that have been proven. So I found that really powerful. And what about whole foods plant-based interventions? Well, this is a really fascinating randomized controlled trial. And it was done in America, and it was a whole foods plant-based intervention. And it was done in an insurance company called Geico. And they gave people an hour-long intervention. I think it was a sort of an education session about the kinds of foods to eat more of. And they also gave them a plant-based option for lunch. They weren't compelled to eat the plant-based option. And there was no control over what they ate at home. But they were just given these weekly sessions for a while and the option to buy something whole foods, plant-based, if they wanted to at work. Now, this was rolled out over 10 cities and involved about 300 people. And predictably, what they found was that, yes, there were reductions in their weight, there were reductions in their risk factors for heart disease, risk factors for diabetes. So they got well physically, but what's fascinating for today's talk is that they got a lot more well mentally as well. They had much better mental health scores and, crucially, productivity scores. These people were actually doing better at work because of what they ate. And I think that more people need to know about that, and certainly in the workplace. So let's move on to the next bit of evidence here. We have a really interesting study on elderly Taiwanese people. Because you have to wonder to yourself, what is it? Is it the vegetables? Is it the lack of other things in the diet? What's doing it? Well, in this study, they had some elderly Taiwanese people, about 1,600 of them, and they realised that the more vegetables they eat, they had a reduced relative risk of depression by up to 62%. And this study here, this is interesting. This was on omnivores, and they got them to try to eat a plant-based diet. Well, they didn't just try; they actually did it. They ate a plant-based diet, and they measured their well-being scores. And after just 2 weeks, these omnivores that switched over to a plant-based diet for that time had statistically significantly improved mood scores. But why? Why would that be? Well, there's lots of potential reasons, but one of them might be tryptophan. Okay, so tryptophan is an amino acid, and it's crucial to making serotonin. Now, this is the weird part. Meat and eggs, very high tryptophan foods. So you'd expect, that if you ate foods that were high in tryptophan, you'd be able to make more serotonin, which is what that's one of the feel-good neurotransmitters. But it simply isn't the case. This study here showed that it was only by eating higher carbohydrate foods that tryptophan became more bioavailable. So the theory goes that it might be something to do with the fact that if you're having a very high protein diet, other amino acids compete with the tryptophan for access to the brain because it has to cross the blood-brain barrier, you see. So it's really interesting that this study in the American Journal of Clinical Nutrition showed us that higher healthy carbohydrate meals actually increase the bioavailability of the tryptophan in our foods. More availability of tryptophan means that we could make more serotonin to feel better. So what foods are high in tryptophan? Well, you've got things like sesame seeds, pumpkin seeds, butternut squash, for example, and you've also got things like lentils, other pulses, chickpeas. So what's great is that yes, they've got the tryptophan, but they've also got the fibre, which boosts the bioavailability. And so this is another interesting one. This looked at mood and cognitive function, and this kind of proves a little bit about what I was just talking about. They had 106 people who were overweight or obese, and they wanted to see if they could do an intervention to improve their weight, which they did. So they took half of them and gave them a low carbohydrate diet, and half of them and gave them a high carbohydrate healthy diet. And they say, okay, so who loses the most weight? Well, after the course of about a year, they both lost equivalent amounts of weight. But what was really interesting was that the ones with the high carbohydrate diet, the healthy high carbohydrate diet, actually had boosted mood scores again. So this kind of harks back to what I was saying earlier, sort of building up the evidence to suggest that there is something to do with the increased fibre content that really boosts the mood. What else is important with mental health? Well, it's our omega-6 and omega-3 ratio as well. Now, omega-6 and omega-3 are really important essential fatty acids that we can't make, so we have to get them through our food. And I don't want to be too negative about omega-6 because it is needed and you can get it from healthy sources like cashew nuts, for example. But in our Western diets, we're in omega-6 overload because we get it from other sources. We get it from all these fatty junk foods that we eat, and that I hasten to say there's loads of here at Vegfest today. That looks like a Vegfest plate to me at the top, but that's full of omega-6 fatty acids, guys. So I would really not make that an everyday food. That's a real sometimes food, okay? But how do we optimize our omega-6? Well, again, it's a little bit about the sort of crowding out of nutrients. So remember I said about the tryptophan, it needs to be bioavailable. The same really applies to omega-3s. We need to make them more bioavailable. So how do we do that? Well, we eat more omega-3 containing foods. They're really important. So things like flax seeds, chia seeds, hemp seeds, walnuts, they contain short-chain omega-3 fatty acids. And if you're on a fully plant-based diet, I would also recommend taking an algae oil supplement which contains ready-made long-chain omega-3 fatty acids, like you would get from fish. Because fish swim in the ocean, and they're not necessarily great at making these omega-3s either. So where do they get them from? Well, they get them from the algae or the algae, yes. That's where they get them from, and they're gulping on this water with the algae in all day, and that's how they get their long-chain omega-3 fatty acids. So why not just take an algae oil supplement with EPA and DHA, and that way you're cutting out the middleman or the middle fish. You don't have to take a cod liver oil capsule, you don't have to take the liver of a cod, because you're getting it from the original source, and that way you're also not exposing yourself to the heavy metals, the dioxins, the PCBs, the microplastics, all the things that these poor fish have been exposed to because of the pollution of our oceans. And you all know that our oceans are really used up. They're so depleted. I heard this morning that 30,000 fish a second are killed. 30,000 fish a second. I heard that in Dr. Mehta's talk this morning, and it really shocked me. So there's lots of reasons why we might want to limit our fish consumption, but if you're worried about the long-chain omega-3s, then you've got the algae oil, and that is a very good replacement. What else could be involved? Well, has anyone heard of homocysteine? Hands up if you know what homocysteine is. A few of you, not many. Okay. So homocysteine is an amino acid, and it's very high in meat-containing foods. And it causes inflammation in our bodies in excess. So if you have too much of it, it can cause oxidative stress and inflammation, which is very bad for our mental health. And there have been studies to suggest that having high homocysteine levels have been linked to depression. So we want to make sure we get them down. So we need 3 things to break down homocysteine in our bodies. 3 things. We need vitamin B12, we need folate vitamin, and we need vitamin B6. Okay, so we need B12, folate, and B6. Now, for all the vegans out there, you need to make sure that you have B12 supplements if you don't know your B12 level, because if you don't have enough B12, you can't break down homocysteine, and you will have high homocysteine levels, which is bad for your long-term health. Luckily, a plant-based diet is abundant in vitamin B6 and in folate vitamins, so you don't need to worry about that. Healthy whole food plant-based diets are optimal for breaking down homocysteine and improving our mental health in the process. What about this study? Dietary folate. We know that folate is a crucial vitamin for boosting our mental health and that it's abundant in a whole foods plant-based diet. It's not the same to take a folic acid supplement, unfortunately. It's really a good idea to get your micronutrients, your phytonutrients from real plant foods as much as you can. In fact, some studies have shown that it's actually detrimental to take excess folic acid supplementation. And this study also backs that up. It's a population study called NAMES, and they looked at big populations over time, and they were able to show that there were depressive symptoms based on reducing the amount of phytonutrients that these large populations ate. So it's not just about what you're not eating, it's about what you are eating. We want more healthy fruits and vegetables, whole grains and beans, and we want less of inflammatory foods, high in omega-6s and high in saturated fats and animal products. So that's the way we generally want to look at things. And very briefly, I also wanted to touch upon artificial sweeteners. They are in over 6,000 different food products, okay? They are endemic, I would say, all right? And some studies have shown that artificial sweeteners can increase the seizure threshold in rats. And I know that we're not rats, so there's not that much human data. But there is data on mental health. Now, this is what really is interesting to me. There was a study that's in the middle there where they were looking at artificial sweeteners on people with bipolar disorder. So people with existing bipolar disorder were given artificial sweeteners, and they had to stop the study early because of the adverse effects on their mental health that were noticed with excess artificial sweetener consumption. So just think about that. If you already have a mental health condition, do you really want to be making it worse through the chewing gum that you're chewing on, or the Coca-Cola with the artificial sweeteners? And as I said, they're everywhere. You have to look at the yogurts, you have to look at the nut milks. There's all sorts of things that can sometimes contain these artificial sweeteners, so just be aware of that. Right. Now, let's get a little bit more detail on what we can do, what we want to do, what we need to do to boost our mental health. I absolutely love this picture. I applaud Canadians everywhere. This is the Canadian food guideline for this year. It was non-industry funded. This is a beautiful plate. You can see that what they want to emphasize is that at least half of what we eat is fruits and vegetables of all different colors and all different varieties. We've got the whole grains there, that's about a quarter of the plate. And if you suffer from celiac disease or non-celiac gluten sensitivity, you'll be looking for other kinds of grains like quinoa or buckwheat noodles or brown rice pasta. So there's lots of options that you can have if you have celiac. And the protein takes up a much smaller proportion of the plate. So this isn't, vegan propaganda here. This is national dietary guidelines. So you can see that actually whole foods plant-based diets can fit in with quite a number of different dietary preferences. And that's something you could explain to your friends and family if they think it's a bit strange. You can say, actually, no, look, even if you want to do these other different diet crazes, you can see that this is a generally healthy plate. Look at how much meat's on there. And it says in the guidelines that the meat is not necessary. You can get your sources of protein from plants as well. But what I loved about these guidelines is not just about the food. They also gave us guidelines on how we should eat. They suggested that we eat slowly and that we eat with family and that we eat mindfully. These are national nutrition guidelines. I just loved it. So if you want to look that up yourselves, then please do. It's the Canadian Food Guidelines. I would also suggest that when you go shopping, try to limit your shopping to things that are really whole foods, things that you recognise as fruits, as vegetables, things like that. If something's got more than 5 ingredients in it, chances are it's got a lot of other stuff that you don't necessarily want. So just check the ingredients list and see for yourselves. The other tip would be to really embrace different flavours. Now, if you're not much into cooking, I know that can be hard, but make a start. Just try to get creative, get interested. Maybe like smoked paprika or hoisin or any number of different kinds of flavours with mushrooms or umami flavours. Sort of get really into it. Find out, diets of abundance. They can be really amazing. Rather than thinking that you're missing out on something, get really creative and excited about all the things you can bring into your diet. I wanted to do this summary slide to help you understand how to boost your microbiome. We talked a little bit about this earlier, but I would again advise you to only take antibiotics if absolutely necessary. Don't do it as a just in case, or maybe, just to be sure. Don't take them unless you know that you have a bacterial infection that needs to be treated. Minimise your antibiotics exposure through diet, and I think most of you will obviously be minimising your animal product exposure, but look at your pesticide exposures as well. The Environmental Working Group has a list of the Dirty Dozen and the Clean 15. These are the fruits and vegetables that they have compiled on USDA data. We don't have the same list here in the UK, but it's still of interest. And you look at the list, and the foods that are in the Clean 15 are the ones that you would generally be okay to buy non-organically, because they won't absorb so much of the pesticides that they use to make them. The Dirty Dozen, however, are far more likely to absorb the pesticides. So if you could try and get those organic, all the better. If you can afford it, you could consider an organic veg box. You could support local farmers, eat seasonally. These are really important things for your gut bugs and your health, as well as to support local farmers producing foods that can sustain us now and into the future. Cut things like antibacterial sprays, because that's going to damage your hand microbiome. Why don't use mouthwashes? That damages your mouth microbiome. There was a study I read recently about how if you're using mouthwash regularly, it could also potentially increase your risk of diabetes. Why? Why is that? Well, if you're killing off the beneficial bugs in your mouth, what you're doing is you're preventing the ability to make nitric oxide in your blood vessels. And so you can see that could lead to increased risk potentially down the line of things like heart disease and diabetes. So there's a long chain of interconnected things that we don't consider, certainly most doctors don't consider, which can impact our long-term health. I've already discussed avoiding processed foods and limiting foods that can damage our gut bugs. Another thing is saturated fats. Saturated fats from animal products and junk foods can, again, disrupt the tight junctions and lead to lipopolysaccharides from the gut, from the gut bug's sort of outer skin, if you like, breaking down, and then that goes into our bloodstream and can cause massive amounts of inflammation, which impacts our mental health as well. The other thing which I didn't put on this slide that I want to really emphasize is that it's also nice to get outside in nature. You're going to be boosting your natural microbiome that way. You can breathe your microbiome by going to forests or going to the coast, going to the beach. So there's loads of ways to get a pet, a cat or a dog. That's another way. They go outside, they'll go foraging, they'll come back in. You'll be exposed to all different bacteria that will actually potentially boost your immune system response and your mood. Finally, and most importantly, I'd like you to consider finding a better way to deal with your stress. These two elderly people are Loma Lindens from California. They are one of the blue zones of the world where you have the highest healthy longevity. This lady is nearly 100. She's driving a car. She's having the time of her life. She is completely functional and happy. And this is Dr. Ellsworth Wareham. Now, he is incredible. He actually died, sadly, last Christmas at the age of 104. But he was operating on people's hearts until he was 95 years old. So he is a prime example of one of the members of the Blue Zone who eat a predominantly, they both eat a fully whole food plant-based diet. But all the Blue Zones, if you look at them, they all eat a 95% plant-based diet. But it's not just about the food. Now, when asked about his secrets to longevity, Dr. Wareham said that it was actually his faith that helped him to stay positive And he said, you know what, if God can look after the universe, I'm sure he can take care of me. So I think, why worry? Why worry? Now that's lovely. Obviously not all of you here are Seventh-day Adventists from Loma Linda, so you may not have that same feeling around being looked after by an omnipotent God. But it does really make the point that we have to find something from outside of ourselves that will hopefully boost our reason for being, boost our well-being, boost our sort of feeling of why we're here. And this is what all the blue zones have in common. It's a hopeful outlook, and the idea of giving a helping hand to other people, focusing on compassion in your life. Obviously they would have a lot of home-cooked foods, they may grow their own foods as well, living an outdoor life with regular daily activities. These are all things that they have in common. Now I'd like you all to think about how you could potentially incorporate some of those things into your own lives. Now again, we're not all going to live in these blue zone communities, but I'm sure each and every one of us can think, maybe I could set up this community group, maybe I could try and look into this veg box, maybe I could try and get my friends enthusiastic about cooking again. Whatever it is, it will all help to boost your healthy longevity and also your mood. I'm wondering which of those things you'd like to incorporate first into your life. And I also just wanted to say that mental health is complicated. You know, we could be doing all of these things and some of us would still be feeling low or depressed or have lots of other life factors that could really be getting us down. And it's naive to say, oh, just eat some broccoli and you'll be fine. No, of course, that's not how this works. But luckily, the easiest thing to start with is what you put on the end of your fork. Okay, so these blue zones, a lot of them have had adverse childhood experiences which could have led them into a deep depression. But these are protective risk factors that help them. So in hopefully sharing them with you today, you can think about things that you could do to help boost your resilience to these things in the future. And ultimately, some of us will suffer from mental health problems despite all of this. So please do reach out, seek help if you need it. I think that counselling and therapy is really important. People go to the gym 3 times a week and they want to work out their muscles. I believe people should feel free to go to therapy every week to work out their minds, to really figure themselves out and understand what they need in life and what they want to give to other people. So just, I suppose, in finishing, my message is clear. Whole foods plant-based nutrition has a vital role to play in boosting our mental health. It can't be everything, but it's a huge thing, because loving the foods that love you back may give you a little bit more love for the life that you live as well. So that's it from me. I just want to let you know that you can follow me on Instagram at Plant Power Doctor. You can sign up for the Plant-Based Health Professionals UK over there, support our activities, and I hope that you enjoy the last hour or so of Vegfest. Thank you so very much, everyone. Thank you.